Reducing a pulled elbow has to be one of the most satisfying tasks in the whole of paediatric emergency medicine. Here's how I tackle them. First off, we need to know what a pulled elbow is. The annular ligament goes around the head of the radius and it basically holds the radius onto the ulnar. In a pulled elbow, this annular ligament slips over the radial head and it sits in between the radial head and the humerus. So it's not a dislocated radial head, it's just that the annular ligament is kind of jammed there in between the radial head and the humerus. This makes it really painful when you try and pronate and supinate your arm. How does a pulled elbow happen? Well, the classic is that a parent is holding the child's arm while they're walking along. The child sort of falls down and the parent lifts the child's arm up. It could be that they're holding the child by the arms and swinging the child. And sometimes it is just that the child's tried to grab onto something else as they've fallen. These are the most common ways that we see pulled elbows being caused. So who gets pulled elbows? It's normally in the age group of between 1 and 5 years old. You don't really see pulled elbows older than that. How do we recognise a pulled elbow when it presents to ED? And particularly, how do we know it's a pulled elbow rather than a fracture or a bony injury? Well, pulled elbows present very classically. So you've got the history we discussed, it'll be in the age group we discussed, but also children with pulled elbows, they tend to have the arm just hanging by the side, but they're clearly not using the arm. They might actually seem quite happy and content while they're not moving the arm and it will just be dangling there. In contrast, children with bony injuries tend to look like they're in more pain. They usually hold the arm close to them and support it while they walk along, and they look like they're in distress. Additionally, when you examine a child with a pulled elbow and their arm's hanging by their side, if you have a feel down all of the bones in their shoulder all the way down their arm without moving the arm, you won't find any bony tenderness, whereas in a fracture you will. With a pulled elbow, they tend to be fine while you're palpating down the bones, but as soon as you lift up their hand, they are in pain. And that's because at that point, you're essentially pronating or supinating the arm, and so that annular ligament is kind of grinding. Commonly, this appears as though they've got a wrist injury rather than an elbow injury because it happens when you pick up their hand at the wrist. But actually, if you have a think about what movement you're doing, you'll realise that pain is coming from the elbow. So we know it's a pulled elbow, we've made a clear clinical diagnosis and our exam supports it, and now it's time to reduce it. There's 2 techniques on how to reduce pulled elbows: hyperpronation and supination flexion. You don't actually need to try them both, one should work. The evidence shows that hyperpronation is a slightly more effective technique. To hyperpronate, you put one hand resting on the child's elbow with your thumb resting on the radial head so you can feel the click. And with the other hand, you hyperpronate their arm by holding their hand and turning their hand over. Mostly, this is going to do the trick. You're going to feel a click, and as soon as you feel that click, even though the child may be distressed at the time and not using the arm immediately, you can be pretty confident that you have reduced the pulled elbow. If that technique doesn't work, you might want to try supination flexion. So there, you also put your hand over the child's elbow and just hold your thumb gently against their radial head so you can feel the click. And then you supinate their arm and flex. Again, you should feel a click. Once you felt the click, the child probably needs a bit of time to calm down and also to forget that their arm is sore because they tend to still think it's painful for maybe 10 minutes or so after. So the trick here is backing off and leaving the child with the parent, encouraging the child to play and use their arm. If you've done this successfully, the arm is going to be totally back to normal. The child will be using it as normal with no pain or distress at all. If it doesn't work and the child's not moving their arm or you didn't feel a click, you need to have a plan B. So what are we thinking if it doesn't work? The first thing we need to consider is it definitely a pulled elbow? Did you definitely get the diagnosis right, or is there something else going on? The first thing I would do is use another technique. So if you've tried hyperpronation, use the supination flexion. Or you could ask someone else to try and reduce the pulled elbow. Sometimes it just might not be your day and someone else trying to reduce the pulled elbow, they may have success. If that's not worked, it's probably time to take a step back and have a think, is this definitely a pulled elbow? Could it actually be a fracture? And if you're not sure at that point, it's a good time to send the child for an x-ray. If the child's still not using the arm and you've tried your different techniques, you've had an x-ray which shows no bony injury, then you need to think about where you go from here. So one option is that you did reduce it, but there's a tear in the annular ligament. Tears mean that although you've reduced the annular ligament so it's back in the right place, there may be a small tear in it, and that will still cause the child some discomfort. If that's the case, it just needs time to heal and it'll be okay. The alternative is that you actually haven't reduced it. The papers show that if you reduce a pulled elbow within the first 2 hours of it being pulled, you're more likely to have success. So it may be if the families come in the next day, for example, that it's going to be a bit more difficult to reduce. If you're not able to reduce it in ED, sometimes it just needs a bit more time. Usually in this situation, I put the child in a collar and a cuff or a broad arm sling, and I'm aiming to try and keep the arm up a bit so that the elbow's flexed, and that position can help the pulled elbow to go back into place. And normally I'd then arrange for some sort of follow-up. If you've got an ED follow-up clinic, it's a good place to bring them back in a few days to see if the pulled elbow's resolved. Most of the cases of pulled elbow you're going to be able to reduce in ED, but there will be a small number that you're not going to be able to reduce and that you'll bring back to your review clinic. An even smaller number is still not going to be right, and at that point that's when they're going to need orthopaedic input, and a very small number will end up needing MRI to work out what's going on, but this is really, really rare. And finally, here are my 3 pro tips on how to reduce your pulled elbow. Tip 1. Do it confidently. When I see people fail to reduce pulled elbows, it's normally because they haven't been confident that they're going to be able to do it. You do actually need to hold the arm and hyperpronate. If you don't hyperpronate, or you're just very slow and gentle, then you're probably not going to feel a click. So do it confidently. Hold the child's arm. It's a quick maneuver to hyperpronate, and then you should be done. Tip 2 is you don't need to press too hard with your thumb. I often see people grabbing the child's elbow and really pressing down on the radial head. That's not the aim of what you're trying to do. You don't need to put any pressure on the radial head for this technique. You're literally just resting your thumb there so that you can feel the click, because then you know that the elbow's gone back into place. So no pressure required on the radial head. Tip 3, don't make this into a bigger deal than it is. It's a very small and quick maneuver. The child will be upset, but it will be very brief, and then you will have fully cured the child and they will be back to normal. You don't need to spend 10 minutes explaining this is what's going to happen, I'm going to hold the arm, I'm going to turn it. It should be a quick procedure. I'm just going to have a quick look, and if it's a pulled elbow, I'm going to reduce it and then just go for it. The whole thing can be resolved very quickly. I think that if we spend a long time trying to build up to it, it can increase anxiety for the child and the family. Hopefully now you too can be confident in managing to reduce a pulled elbow in the ED. If you enjoyed this video, you might like our video on how to drain a paronychia, which you can see here.